Can you use Botox around the mouth? First of all, let's talk about what people want when they come to me for mouth rejuvenation because their mouth and the perioral area looks aged. They come for a couple of different reasons. Number one, their lip gets thin. We lose some deep fat that makes our lip look thinner as we age. Number two, in women, only in women, they often will get vertical radial lines around the mouth. This can come and be accentuated by muscle movement, by pursing the lips. We call them smoker's lines, but in my experience, they don't just happen to smokers. They happen to everyone who's really thin and who doesn't have a lot of fat around the mouth. What is the best treatment for wrinkles around the mouth? Two treatments exist for this. One is to fill the lip. So we can fill the substance of the red lip, and that makes the lower part of these wrinkles look better. The second is we can use a little bit of botulinum toxin, Botox, and there are other substances, other botulinum toxins that aren't Botox. Botox is a trade name. We can use them in the muscles that create the wrinkles. Now it's interesting, men don't get these wrinkles. Why? Because we have thicker skin in our upper lip because of the hair on the upper lip. Even men that don't have hair and they're shaving their mustache, the skin is thicker so it doesn't tend to infold when we purse it. So they don't tend to get the wrinkles nearly as much as women do. How long does it take for Botox to work around the mouth? Now, the way Botox works, the way botulinum toxin works, is we inject it a little bit into the muscle, the sphincter muscle, that purses our lip. And as such, it takes as long a period of time to work as any botulinum toxin takes to work in any area. We inject it today, 3 or 4 areas on the upper lip. It starts to work in about a day and a half, and the maximum function or the maximum defunction of the muscle is in about 7 to 10 days. It'll last for about 3 to 5 months. Does Botox work on deep lines around the mouth? It can work on deep lines if the deep lines are for muscle movement. But if the lines are etched into the skin and we get lots of deep wrinkles without even moving our muscles, it's not going to work nearly as well. The big thing that patients need to know that get botulinum toxin around their mouth is we can't overuse the botulinum toxin. More is not better. The reason is we have to use these muscles for function. We've got to use them for sipping on a straw, for talking, eating, chewing, etc. And if we don't have good function of those muscles, we have a problem. We have a functional problem. So I tell my patients, this will diminish the wrinkles. It may not make them completely go away. So for me, botulinum toxin is part of my armamentarium for wrinkles around the mouth. I may use resurfacing, laser or chemical peel. I may use filler, and I certainly use botulinum toxin. If you have questions about your mouth and how it's aging, about your face, about your neck, about any of this, come see me. I'm glad to talk to you. I'm glad to answer your questions, and I'm certainly glad to see you in the office. Thanks a lot for watching.